Hello, my name is Kimberly Munoz Aguirre. The topic is Therapeutic Hypothermia after hospital cardiac arrest in children. Definition. Therapeutic hypothermia for comatose adults who have an hospital cardiac arrest was recommended. In hospital cardiac arrest in children commonly results in a poor long-term functional outcome in survivors.
What is therapeutic hypothermia? You're watching this video because your baby needs therapeutic hypothermia, which is also commonly called cooling. Thanks to medical research, we know that cooling your baby by 3 degrees for 3 days can improve your baby's outcomes and protect your baby's developing brain. There are lots of reasons why babies need to receive therapeutic cooling. Your baby will be cooled using a cooling blanket and will be asleep throughout the entire process. The technology and the equipment in the neonatal intensive care unit can seem super scary, especially when your baby is so small. So it's really important to remember that your precious baby will receive expert intensive care and medication. The team will make sure your baby remains comfortable while receiving the cooling therapy, which offers neuroprotection, leading to less neurodisability and better long-term neurodevelopmental outcomes for your baby.
Application in nursing. Application in nursing. Outcomes in the hospital setting are significantly better than those in the out-hospital setting. Cardiac arrest in children in the hospital is due to pre-existing condition. The initial heart rate in patient, the cause of the cardiac arrest, and the initial resuscitation skill of the responder. Needed.
Sudden cardiac arrest and a heart attack are two different conditions. With a heart attack, there is a problem with the blood supply to the heart, and it leads to areas of the heart not working as well. With a cardiac arrest, there is electrical chaos in the heart, and it's usually fatal within 10 minutes. Sudden cardiac arrest accounts for almost 1,000 Americans a day losing their lives. We're very excited about these new research findings that we are presenting in this paper. At least 50% of people who will suffer a cardiac arrest have symptoms in the month before their fatal event. This is new because earlier on we had only focused on the immediate time preceding the cardiac arrest, so patients who are known to have heart disease, especially in the holiday season and New Year coming up, when we identify a peak in sudden cardiac arrests. If they have unusual symptoms of chest pain or palpitations or passing out, then they need to contact their healthcare provider. If it looks like the symptoms are dire, then the sooner you call 911, the better it will be. And this is just our first step into understanding the relationship between symptoms and future cardiac arrest.
Pros and cons. Pros. Secondary outcomes were survival at 12 months of the cardiac arrest and change in the neurobehavioral function, which was measured as the difference between the baseline measurement before cardiac arrest and the 12 months measuring. Cons. The primary cause of the was the withdrawal of life support owing to a poor neurologic prognosis in 39% in the hypothermia group and 33% in the normothermia group or cardiovascular failure, with no significant difference between groups.
Hi, I'm Dr. Peter Antevi, and here for another edition of the Antevi Minute. Therapeutic hypothermia has been a hot topic for both adult and pediatrics, but there's something about the pediatric guidelines that we should probably look deeper into the science about. Let's take a look. And so I'll show you two studies, and then I'll show you the guideline recommendations. The first study was a positive study looking at 42 children. The hypothermic group had a significantly increased survival to discharge. Their neurologic outcomes were better, but not statistically better. So this was a positive study published in 2013. The THAPCA trial, which was a very large out-of-hospital arrest trial, you can see here that although it seems that the hypothermia group did better both for survival and good function, none of these numbers were statistically significant. So that's a very interesting point there. So what do the guidelines do? They said this was a negative trial. The guidelines basically hedged, and they said you can either do 5 days of normothermia or 2 days of continuous hypothermia followed by 3 days of continuous normothermia. This is the only place in the guidelines that you'll find the recommendation for hypothermia, and it's in pediatric out-of-hospital cardiac arrest.
Use applied in Ecuador. Use applied in Ecuador. Trials comparing therapeutic hypothermia with therapeutic normothermia have shown no significant difference between the two interventions in outcomes. A possible mechanism underlying the initial reports of a benefit of hypothermia over conventional treatment is that therapeutic normothermia is also beneficial.
A healthy heart beats in a regular and coordinated way at a rate between 60 and 100 beats per minute to pump blood to your body and brain. However, heart disease can cause your heart to suddenly start beating very fast and quiver instead of pumping blood effectively. If left untreated, this rapid heartbeat can cause sudden cardiac arrest and may lead to death in minutes. Many different conditions can put you at risk of sudden cardiac arrest. These include if you have heart failure, if you have a heart that pumps poorly, if you have had a heart attack, if you have survived an episode of sudden cardiac arrest, or if you have a family member who has experienced sudden cardiac arrest. It's important to take appropriate action as soon as possible because sudden cardiac arrest can happen at any time. There is no way to predict when it will occur, and there are no specific symptoms or warnings.
In conclusion, in comatose children who survive in hospital cardiac arrest, therapeutic hypothermia as compared with therapeutic normothermia did not confer a significant benefit with respect to survival with a good functional outcome at 1 year.
21-year-old Jay Eam is recovering at Ronald Reagan UCLA Medical Center after collapsing in full cardiac arrest while running the recent LA Marathon.
I went from running for the LA Marathon and then suddenly, just kind of fighting to live.
Good for you. Finally out of that bed.
Jay's life was saved by an uncommon twist of fate. 15-year veteran LAPD officer Joshua Sewell was at milepost 18 when Jay went down.
That's usually about the point, people start to get dehydrated and their legs lock up and so forth. So we figured it was just another case of, dehydration or muscle fatigue or something like that. I took a pulse at that point. There was no pulse, no breathing. Rolled his eyelids back. His eyes were rolled back into his head. So he was in full cardiac arrest at that point.
Officer Sewell immediately began CPR.
How are you, sir?
Much better.
And UCLA physician and professor of surgery, Dr. Charles Chandler, just happened to be 50 yards from the scene.
I was on my way to work, but decided to stop by as a spectator. I just made a quick assessment of how he was, what the likely problem was, and who was doing what, and how well they were doing it, and what he needed, and how to get him out of there.
Jay was rushed to Ronald Reagan UCLA Medical Center, where fate again intervened. UCLA is one of only a handful of hospitals equipped with a sophisticated thermo-cooling device that doctors could employ to again save Jay's life.
Most people who have cardiac arrest out in the field, as we say, on the street, don't survive, most. The catheter comes in here, and so this is a machine. It's a cooling instrument, which consists of a catheter that goes into the blood vessel, and it's a catheter that basically circulates cold fluid inside of this blood vein, and that allows you to cool the blood like a radiator cools a car.
UCLA helped to develop this technology that puts the body into a state similar to hibernation, protecting it from damage. Jay was placed in a coma-like state and cooled to 89 degrees Fahrenheit for 3 days, then slowly brought back to a normal temperature.
He's not had any real sign of permanent brain damage, so this therapy really saved him, and he's doing excellent. Put your hands up like this.
I haven't heard of them using it before, so I'm actually surprised that it works so well, so I'm completely grateful for that.
It's amazing. It's amazing. Every night I always called to check up on him because he was just like, we were rooting for him, and so it was such a beautiful recovery for him.
Jay is expected to make a full recovery. He's a pre-med student who plans to become an ER doctor. And Officer Sewell, who is also a runner, says whenever Jay's ready, he will strap on his running shoes and they will finish the last few miles of the marathon together.
Absolute miracle. It was, the marathon itself is near and dear to my heart. I ran it in 2006, and being able to, assist another runner like this is just beyond words.